Welcome, everybody. Before we get started, I want to congratulate our Colorado legislators in coming into session, brief session. They're going to be back in February. We're excited to welcome a guest today to talk about Paycheck Protection Program and how small businesses can get relief. We are awaiting numbers today. Yesterday, we had 2,281 new cases, 818 hospitalized. So we watch that every day, that hospitalization number. Our North Star has always been we don't want to overwhelm our hospitals, because if you have a heart attack, stroke, appendicitis, or COVID, we want to make sure that you can get the life-saving care that you need to get better. And so far, we've accomplished that in Colorado. It was close to the wire. About a month ago in early December, we were at about 1,600 hospitalizations. If it had continued on that trajectory, we would have had to open the auxiliary sites. Thankfully, we are at a number where there is capacity in our hospitals. Whatever you need. But look, as I've said before, we are in a race for time against this virus. The more quickly we can vaccinate folks, the quicker we end the pandemic and save lives. Now, today I come before you extremely disappointed that we were lied to with plans of the administration to release reserve doses that were to be the second doses of the vaccine. I was informed by General Perna today that there is no Federal Reserve of doses. They anticipate that every second dose will be delivered, but it'll be delivered in the future off of the supply chain. And so there is no influx of doses, contrary to a call we had with the Vice President, the Secretary of Health 3 days ago, where they informed us we would be getting additional quantity available to the states. There is not that additional quantity available for any states. So we have a little bit more visibility into the quantities of vaccines we'll be getting in the short to medium term. I'll go through that. We were led to believe just a few days ago the federal government was going to release their stockpile of second doses. That would have equated to about 3 weeks supply in 1 week for Colorado, about 210,000 or so doses. And that was unfortunately not true. And we were ready to deploy it right away. And now we know that it simply doesn't exist. We're going to continue to do everything we can to deliver the doses that we do have effectively and efficiently. We anticipate about 70,000 per week, and I'll walk you through a little bit about what we know about the supply and what we're expecting. So we are now January 18th to 24th. We know very well what we're going to get this week. Next week, they have informed us it's 34,700 Moderna, 35,000, I'll put an M by it, 35,100 Pfizer. Now, we do something to these numbers. These numbers equal 69,800. However, what we did early on in Colorado, in recognition of the clinical fact that there are 6 doses in every 5-dose vial of Pfizer and 11 doses in every 10-dose vial of Moderna, is that we actually correct these numbers, and that leads to 77,950 doses next week in Colorado for us to use. We hold all of our provider partners accountable for using every single dose from the vial and measured with precision, and we've been fairly effective at recognizing numbers that are very close to those numbers. The next week, January 25th to 31, we are expecting a similar amount. In fact, we're expecting about the same amount. So there'll be another week of that. After that, we are expecting the amount to go up. Again, we have been misled before, and perhaps there would be unanticipated changes in the supply chain. But for the weeks of February 1 to 7, February 8 to 14, February 15 to 21. We are expecting the supply in about the 90 to 100,000 range. Now, we are also hopeful at some point in here there could be FDA approval of Johnson & Johnson vaccine. That would be the third vaccine, a one-course vaccine. We don't yet have visibility into quantity. We don't believe it would exceed the 30 to 40,000 a week of Moderna and Pfizer, but we will be able to incorporate that in when it's approved and when we know the quantity. We feel that with these quantities, we can still achieve our goal of 70% of people 70 and up inoculated successfully by the end of February. But the more doses that we get sooner, the sooner we can start 65 and up, the sooner we can start teachers and bus drivers and others that work on the front lines. And I'm very hopeful that the Biden administration's goal of 100 million doses in 100 days will be a reality. And here in Colorado, we are ready to deliver those doses and use every dose every week. I want to take a moment to provide an update on phase 1A of our vaccine distribution plan. We talked about January 15th as the goal for the state when we would largely be done with 1A. I'm proud to say that we are. Doesn't mean that there are some healthcare workers that might trickle in, but by and large, the prioritization is 70 and up, 70 and up, 70 and up. That started 2 weeks ago in many areas, but there were still healthcare workers that needed to be vaccinated. By the 15th, by today, our highest healthcare risk healthcare workers who work in COVID wards, who work around patients who have COVID, those who want it have received at least one dose. Many are already receiving their second dose. And also the majority of skilled nursing will have gotten their first dose. And we're very excited about that. To date, 64,500 first doses have been administered to frontline healthcare workers. That's about 85%. 48,000 second doses have been administered to frontline healthcare workers. We're also working very closely with the Federal Pharmacy Program, which partners with CVS and Walgreens to vaccinate staff and residents at skilled nursing facilities, at long-term healthcare facilities. That program has gone slower than we would like. That's the one part of the vaccine distribution that is directly under federal contract, out of the state control. But even with the challenges they faced and with us being on top of them every step of the way, Walgreens and CVS have now administered 97% of doses to skilled nursing homes. That means 203 of the 209 skilled nursing home facilities in our state have already gotten the dose. They're going to finish 100% for both skilled nursing facilities and long-term care facilities by January 30th, the second dose by the end of February. We wanted to make them go faster. So to provide protection sooner, we offered to administer doses to 30 long-term care facilities. We said, let us work backward, let the state take on some. So far, one of those facilities has accepted our offer. 11 are keeping with the federal contract and program. We're also reaching out to the few facilities in our state that did not get scheduled with CVS or Walgreens. The state will administer those doses when the facility agrees for a date for their residents and staff. And we have 4 long-term care facilities that have taken us up, that we've gotten a date. Staff, residents will get that. I'm proud to say that in addition to those who live in nursing homes and senior living, tens of thousands of seniors that have already gotten the vaccine, we're close to 40,000 members of the general public, age 70 and up, that have already gotten the vaccine here in Colorado. And that number is going to increase rapidly now that that is the focus of very close to 100% of our doses that are available. Vaccines are our path back to the Colorado that we know and love. And we're very excited about the progress that we've made so far. And let's go to the next slide. Oh, not that one. 2 slides back. I think it was the one that showed. There we go. This is where we are with the first doses in Colorado. So we've received 300,100. And we have used already in people's arms 242,000. So that leaves about 58,000. They will likely all or almost all be used by Sunday by the time we get the next doses. There's a lot of clinics scheduled this weekend. The remainder of them almost all going to 70 and up. Again, there's a few healthcare workers here and there now that are still getting them. But we have one of the highest rates of successfully getting the vaccines into arms of all the states in the nation. We're very proud of that. We want to continue that. That being said, when you look at these quantities, 79,000 a week, we have 530,000 Coloradans over the age of 70. So you can do the math, and that is very frustrating for folks who say, what about my aunt? What about my grandma? What about my grandpa? Because some will get it next week, some will be getting it into February. There's simply not enough that we are receiving to do everybody next week. If we had the 250,000, we would have gotten them all out in 1 week. It would have met half of all the 70 and up within a week. But we're still confident we'll meet the 70% of 70 and up by the end of February. With these numbers, that's a baseline. We were very conservative in setting that wildly important goal. We will achieve that. But we there's no question that this is a disappointing development that our vaccine supply will stay in the parameters that I indicated earlier, around 70 to 80,000 a week this week, next week, going up to 90 to 100 for a few weeks, again, with the possible addition of Johnson & Johnson when approved, with uncertainties, the exact numbers there. So look, to make the vaccine work, it's got to be used. That's why early on we established that all of our provider partners, hospitals, community health clinics, pharmacies have to use every dose within 3 days. There's been cases where if they didn't, we just transfer it to another partner who will successfully get that into arms. That's part of the secret to our success. I expect that we'll use essentially every first dose that we have in Colorado by Sunday, Monday, which is fortunate because that's about when we start getting the new ones. Monday, Tuesday is when we get the next week's dose at about 77 to 79,000 doses for next week. Look, the more vaccines we're getting administered, the more that we protect people. It starts that protection clock. They need the second one 21 days later, 28 days later. The Johnson & Johnson is a one and done. If and when that is approved, it's a single vaccine. And we're obviously very excited about that opportunity as well. The more vaccines are administered, the quicker, the more we receive, the more we can get back to jobs and growth and our way of life. And the more the vaccine gets out, the more businesses can thrive and succeed. Since the early days of the pandemic, we've taken a lot of actions in Colorado to help small businesses, and I want to highlight some that we have for small businesses today. And we have a small business here to talk about their participation in the Paycheck Protection Program. Energize Colorado has been a great success. The fund provided more than $25 million in small business loans and grants to small and micro businesses across our state. That's 25 employees or less. A lot of great applications. That money has gone out the door. We wish it was more. There were more fundable projects that could have been funded. Applications have closed, but they're still evaluating funds and awarding grants. And that money is largely out the door. There's a little bit more to go. Rural Jumpstart provides tax relief to new businesses and their employees located in rural Colorado. That's 21 companies participating in that program. And then in the special session, our Democrats and Republicans came together to provide tax relief for small businesses, for restaurants, $57 million in direct aid and grants, and waiving fees for restaurants, state fees that they have to pay, liquor licenses, inspection fees, really helping some of the hardest hit small businesses, restaurants, bars, and caterers across Colorado. For the direct assistance piece that's funded by the state, local businesses should reach out to their local governments. And many applications are closing at the end of the month. We had some parameters around making sure that money got out quickly. In Boulder, getting the applications by January 29th, Denver, January 27th, Douglas, January 29th, La Plata, February 1st. So all of the deadlines for those applications are the last week in January or first day in February. Don't miss out on that. They've made it very easy for small businesses to apply. You can visit the Small Business Relief website listed here to get more information for your small business about how to help. Now look, we do what we can in Colorado with the resources we have, but the federal government has a lot more resources to help, and I'm very grateful that they passed a new round of Paycheck Protection programs to help our small businesses get through this difficult time. Now, it's a little bit different than the first round in two ways. The first round applied to effectively every small, medium-sized business in our country, and many participated. This one, you have to show that for 1 quarter of the last year, you were down 25% in your business. And that would cover essentially every retail business, restaurant, many wholesale companies, some service and tech companies it wouldn't cover because they didn't have a 25% down quarter. But if you were 25% down for 1 quarter in the last calendar year, you qualify to get 2.5 months of payroll in PPP. And here's the good news for restaurants and food businesses, 3.5 months of payroll, especially for some of those hardest hit businesses. We want to make this as easy as possible from the Colorado perspective. Visit our OEdit website, the Paycheck Protection Program website. Contact your banker for more information. To try to demystify this, I welcomed and invited a Colorado small business owner who benefited from Paycheck Protection Program, intends to apply again in this new round. I'm happy to turn it over to Kit Keeling, the founder of Orderly Health, to discuss how Paycheck Protection Program can help your small business get through this and keep people on payroll. Kit?
Thank you very much, Governor Polis. It's my pleasure to be speaking today. My name is Kit Keeling, and I'm the president and co-founder of Orderly Health. I got my start here in Colorado. I went to the United States Air Force Academy, following which I spent 10 years on active duty as a physician in the military. Most of my time was spent at Walter Reed Hospital in Washington, D.C. I also volunteered to deploy twice in support of Operation Iraqi Freedom and Operation Enduring Freedom, where I ran intensive care units for local host national children. Following my military service, I moved back to Colorado, spent some time at the Children's Hospital of Colorado, and then moved on to Orderly Health. We founded Orderly Health with the intention to help patients navigate the increasingly complex healthcare ecosystem that exists. And we realized that the only way to do that was through better data. Orderly Health is a Colorado-grown company. My CEO and co-founder is from Denver, went to Cherry Creek High School. We went through the Techstars program in Boulder. We received an OEDIT grant from the Advanced Industries program, and we're an active part of the Denver Startup Network. However, this time last year, we found ourselves on our heels. The economic uncertainty that COVID presented forced a lot of healthcare companies, in fact, a lot of companies in general, to tighten their belts, turn inward, and not really seek alternatives from outside vendors. Frankly, we were on the precipice of going out of business. We applied for the Paycheck Protection Program, and we received $130,000 in funding. We actually just found out on Monday of this week that that loan was forgiven. But with that $130,000, we took 5 FTEs and grew our business into 22 FTEs. We hired a number of Coloradans and a number of diverse talent. I'm extremely excited about the team that we were able to build. We also were able to land our first significant client, through which we were able to help Coloradans, specifically veterans, military members, and their families. If you've ever tried to find a doctor, you know the problem that we're solving. Going to your insurance company's website and trying to determine if the doctor you want to see takes your insurance, if she's in your network, if she's at the location that the website states. Across the country, that data is about 55% accurate. Our system uses machine learning and artificial intelligence to drastically improve the accuracy of that directory, and thus improving the experience of patients. We also offer a suite of APIs to improve the interoperability of data within the healthcare system. Governor Polis, I very much appreciate the opportunity to share our experience. I'm very thankful for the Paycheck Protection Program. Look forward to applying again. And if folks have any questions about Orderly Health, please visit us at orderlyhealth.com. Thank you very much.
Now, and here's the exciting news. When it comes to getting the vaccine, it doesn't matter who your network is or your insurer is. So you don't need to use any websites like that. It is free for everybody. Doesn't matter where you get it is in-network, out-of-network, whether you're a customer there or not. They're open to everybody. And so a lot of and you can go to our covid19.colorado.gov site and then click on vaccine information. If you're over 70, sign up at a provider near you. You may get lucky and be called tomorrow. You may get called in 2 weeks. You will get called. Everybody who wants it by the end of February, even with the conservative supply estimates that we have. But the good news is, pick one that's convenient for you, because it doesn't matter who your carrier is, it doesn't matter who your normal provider is. It is free, there is no copay, and you will have the opportunity to get it if you are over 70 in the coming weeks, and it will be life-saving. People over 70 represent 78%, over 3/4 of the deaths from COVID-19 here in Colorado, and just under 50% of the hospitalizations. So we will make substantial progress by the end of February. Now, again, the protection would start by the end of March with the month lag, but great progress in this pandemic on the hospitalization and death rate. The pandemic will still be here. We need larger max vaccination programs. We're looking forward to 100 million Americans in 100 days. That would translate into close to 1/3 of all Coloradans. At that point, it will be the essential workforce, 65 and up, many, many others in that first 100 days, if if the federal government is able to come through on that supply. And regardless of who's president, I just want to make sure the federal government is upfront and honest with all of us at the state level. It's very frustrating and creates a great inability to plan when these numbers are changed around large amounts. One of my biggest pieces of advice, I met with we met with the outgoing and the COVID task force, what's left of it from Trump, the incoming COVID people from the Biden administration. I said, if you can get to 2 weeks' notice for us, that would be welcome. We can plan and scale to almost any level within 2 weeks. 1 week, we'll do our best. Now, these big changes in 4 or 5 days, very, very difficult, and especially the big disappointment we had this week that, in fact, there is no Federal Reserve for the second dose and that every dose has already been sent out. Not that that policy was inadvisable. We're glad that every dose was sent out, but the fact that on several calls with state governors, the White House led us all to believe that that there was a second dose that had been paired that would be released soon. So we're in the home stretch now. It's more important than ever before to wear a mask, stay 6 feet from others, avoid social interactions with people outside of your home. That day will come soon. Your grandparents, your aunts, your uncles, yourself, if you're over 70, will be protected soon. Thereafter, people over 65, critical workers, all happening. Soon it'll be you if you don't fit into one of those early groups. And the pandemic will end, and we'll get through this together. We're happy to take some questions.
Reserve, would we have been ahead of schedule then when it comes to vaccinating 70 plus?
Yeah, our goal was 70% at the end of February. We were ready, if we had gotten that reserve, to be able to move and expand that group earlier, right? And so I think some states are regretting that they've already opened up larger groups because that, of course, deprioritizes 70 and up. If you go to 60 or 65 or large groups, we would have been thrilled to be there because after 1 week of 250, we would have gotten more than half of 70 and up done. When you get to more than half of a group, we're ready to open up the next group. So when we got to about half of the 1A, that's when we went to 1B because you don't want to slow down. You don't want to be like, this is where some states ran into trouble. They wanted to wait till they were like done with the group before they moved on to the next. And you might recall we moved on to 70 and up 2 weeks ago while we were still doing 1A in many areas. Now, of course, that's frustrating to some 70 up who said, I couldn't get it, I heard I could, but at the same time, 50,000 people 70 and up did, and that would have all been sitting on shelves had we not started with that process while we were still doing 1A. So we're confident we'll meet our 70% of 70 and up by the end of February, but yeah, this is, we were hoping that next week we would be able to get to close to half of the 70 and up.
Hello, Governor Polis. This is Vinny Galchunas of Bloomberg News in Denver. I know this is a little bit of a sensitive topic, but I'd like to go over it again. You say Colorado was lied to on the pipeline, the vaccine pipeline. Was this vengeance on the part of the outgoing administration or bungling? Would you say you're a little bit angry about the whole thing? Thank you, Governor.
Yeah, not just Colorado. All the governors, the entire country was lied to. I mean, the press reported on it, doing your job, that these were in reserve. I mean, everybody had reported on what they said. I'm not going to cast aspersions. My guess is it's gross incompetence. I'm not going to attribute a motive of vengeance. I'm going to say gross incompetence, but I could err on the side of my optimistic view of human nature.
I have two questions. One is, what's the mechanism for distributing these vaccines among all the entities that are putting it out right now? UC Health and Kaiser, some of the smaller providers and stuff. Who in the state decides that, and who decides who gets how much and when? Yeah. And then related to that is, since more of these entities are making it clear that they're providing the vaccine to people who don't belong to their system, like Kaiser Permanente, a lot of people are starting to register among many of these, taking the best shot, seeing where they get the vaccine quickest, and is that problematic?
Yeah, and that's okay. People are doing that, but when you're called up for the vaccine, remove yourself from the others, or if you get the email that you're up, you simply won't respond. I mean, nobody's going to want to schedule themselves twice for the same vaccine. So, I mean, I think this will work its way out. Effectively, when there's spaces, people get notified, it's randomized. If you've already had it, you're not going to be scheduling yourself again for it. But yes, people are doing that. We don't see it as a problem because we don't see people getting 2 doses. It doesn't do any good to get 2 doses. It's not. We don't see that happening. Yeah, people are, if you're in a system, you're already in their lottery if you're 70 and up. So people that are in Kaiser, in UC Health, Centura, if you already are a patient there, you are already in their lottery, along with and on equal footing with anybody who signed up that's not in their system. So there's people who get notified via email or phone that hey, I'm 74, you can get it, you want to schedule it, and they didn't do anything. And that's fine. It's because they were already known. It turns out that most people over 70 and up are actually in the system of a provider because they got some form of medical care. We estimate probably in excess of 80% of people over 70 are in one of the networks of community health clinics or hospitals or providers simply because they've had some form of medical care in the last 5 years. But making sure that we reach that other 20% that isn't and that it's easy to sign up, we do in two ways. One, you go online and sign up. And one of the criteria we have in working with providers is that they have a public portal for people to sign up and be randomized and that they don't give a preference to people who are or aren't their customers. The second thing we do is we have the ability to do stand-up clinics in communities that are medically underserved. So we were in the San Luis Valley and did Center in San Luis. We did a black church in Denver last weekend. We're going to augment the community health clinics, which already reach the medically underserved, the conventional hospitals, the pharmacies, with the ability to go into small towns and say, everybody's 70 and up, let's go. And that's complements those who might not be on the list of a provider or might not have been the customer, might not know how to use the internet, might not know how to sign up, all of those things as well. So through these mechanisms, we feel we can essentially reach everybody that's 70 and up in the state and reach the wildly important goal of protecting 70% or more of 70 and up by the end of February. And we gave the we gave a breakdown. It's about half. It's about 50% go out through hospitals, about 20% through community health clinics, 20% through local health partnerships, 10% through pharmacies. That's the rough estimate. We'll give updates on that exact number on a rolling basis over time. Quick follow-up.
That was it. Who is it that's deciding that this bulk of vaccine on this week is going to go to Kaiser or is going to go to UC Health?
Essentially, it's based on proven ability to get it into arms. So again, when providers, if they take more than 3 days and we have to reassign it, they will be deprioritized. We want to make sure that every dose is used promptly, and then we look at geographic equity and making sure that it's available in other areas. We augment that with the stand-up clinics that we do. Obviously, many of the large systems have a number of regional presence across the state.
Hello, Governor. Bill Folsom at News 5 in Colorado Springs and Pueblo. Been doing stories with a lot of the 70 plus, very anxious to get it, which is great, but they're also anxious to get out the door, marking their calendars. Is there any discussion with your medical people, even though they may be immune, can they suddenly become a spreader crowd in a couple weeks when they start heading out the door?
So let me see if I understand. Could you repeat your question? I'm not sure I understand it. When somebody is successfully vaccinated, and then, go ahead, repeat it again.
I'm trying to find out if we're creating a crowd that may be immune themselves, but may become a super spreader group that are going to head out the door.
So the data is still out on whether the people that are immune from the virus can transmit the virus. The current guidance is that they can. It's not been demonstrated that the vaccine prevents transmission. It has been demonstrated that the vaccine prevents infection, and among those who are infected, has a major effect on preventing severe life-threatening symptoms. So that's what's been demonstrated. It has not been demonstrated that the vaccination eliminates transferability. So again, it would be a safe environment when once everybody in a senior living facility is immune, right? First shot, 21 days later, second shot, 2 days after that, it's safe for them to begin playing poker again and hanging out together and all of those social activities that they've struggled mightily because they have been very dangerous this last year. In terms of when they're out in the community, it's still possible that they could be contagious, even though they themselves would not be infected or have symptoms from the virus. We simply don't have all that data yet.
To the families of those 70 and plus and those 70 and plus who have been waiting a long time to get that vaccination and now have to wait an additional few weeks to potentially start their vaccination process?
Well, first of all, the most exciting thing to me is when I hear from, people in their 70s and 80s who I don't even know commenting, I got my shot yesterday, I got mine last week, I'm scheduled for next Tuesday. Every shot's being used in real time, every moment. We'll have used every vaccine in the state by Sunday, Monday, very close to it. The long-term care folks are taking a little bit longer with theirs. January 31st, first dose will all be administered. But we also know that when you receive 78,000 in a week and you have 530,000 people over 70, it takes a number of weeks till everybody over 70 can receive that vaccination. It will be fair. It will be impartial. People are receiving it every day. If you've been a customer or you are at UC Health or Kaiser or Centura or a community health clinic, you will get notified. If you're not and have had no medical care for a long time, sign up on one of those lists. And we'll also watch for community events in underserved communities. It might be at your church, it might be at your club. And by the end of February, even with these conservative estimates on dosage that we're basing our modeling off of, we're confident that everybody who wants it over 70 will have been able to have the first dose. And there's upside in these projections. We talked about Johnson & Johnson could come on board quicker. We don't know quantities. There could be additional ramp up towards the end of February. We talked about the 90 to 100,000. That's likely to be the number early February. It's possible by the end of February, certainly early March, that those Pfizer and Moderna numbers would likely increase as well.
Hi, Governor. This is Joe Vaccarelli with Denver 7. I actually have two questions. One, what is the state protocol for protecting the vaccine once it's shipped, given that we've lost more than 400 doses in the past week due to refrigeration issues in Lakewood and Pueblo? And second, regarding security over this weekend and during Inauguration Day, I mean, what steps were being taken and what concerns do you have about potential violence in Colorado? State capital?
Yeah, I mean, look, there are freak events. There was a power outage at a Kaiser facility. It affected several hundred doses. They were able to quickly administer most of those. I think they lost 160. There were also some that were lost in Pueblo. We want to get it out. We want people to be responsible. And of course, if there is any provider we partner with that shows a pattern of irresponsibility or lack of maintaining the standards that are necessary, that would be reflected in us using other providers to get the vaccine out. That being said, we understand there can be what, in business terms, insurance terms, are often called acts of God. There's a power outage. We're not about to require that every place we send it to has a backup power system. That would mean we wouldn't be able to get it to many areas of our state, including rural Colorado. There will be power outages. What's important is that folks identify quickly, use all the doses they can. In those scenarios, all of the guidelines about who the doses should be used for are waived, meaning if you're on the clock because you have a big power outage, you give it to any arm, whether they're a healthy 25-year-old or a 60-year-old. The priority is not to waste it, use it. We are making that clear with the guidance that we have as well. We are also, this is back in the announcement section because somehow I skipped over this in my remarks, but it is very important. I'm issuing an executive order today that makes sure that providers do not charge any copay or fees and also don't discriminate on the basis of ability to pay. And that will be clarified and fully implemented through this executive order. Doesn't matter who your insurance carrier is, if you don't have insurance, any of that. Federally funded vaccine, ready to go. You are on equal footing as anybody else. Sign up and get it if you're over 70. We can take one more.
Related to the wasted vaccine, some states and communities have created like a waiting list or something online so that if there's something that's going to be expired or lost, they call you within just a few minutes, you run down and you get it. Is the state considering something like that?
That's a good idea. Well, that needs to be done at the local level because you can't drive 3 hours. So, I mean, yes, that's great. Communities should do that because when you have a freak event like a power outage, you have 120 doses, quick, whoever can show up in an hour gets it. That's a great way to reduce waste. There's only been 2 incidences of waste in Colorado that I'm aware of. Both were freak incidents that I don't represent a pattern of poor stewardship. Neither one will be reflected in our relationship with Kaiser or with Pueblo, but we always watch to make sure that there's not any kind of pattern of lack of quality control around protecting the vaccine. Phone.
Hello, Governor. This is Jennifer Oldham with the Washington Post. I have 2 questions. One is, are there any credible threats against people or facilities heading into the inauguration next week? And how are you working with law enforcement to prepare for possible unrest leading up to the inauguration in the next week?
Colorado is proud to do our part, sending over 200 members of the Colorado National Guard to Washington, D.C. to help ensure a peaceful transition of power in our nation's capital. We've been informed that there are threats in all 50 states regarding our capital complexes. We don't have any additional information to share about Colorado-specific threats. I can tell you that we have had cross-jurisdictional meetings with our Denver Police Department, neighboring police departments, Colorado State Troopers, to make sure that we are prepared to secure our state capital here in Denver.
El gobernador Jesús Carragel from Noticias Univisión, Colorado. Gobernador, hemos visto cómo en distintos lugares del estado ha habido problemas de luz y de refrigeración de las vacunas. ¿Qué hará usted para garantizar la preservación de la vacuna y cuándo llegarán más de ellas a Colorado?
Hospitales están determinando qué medidas pueden tomar en el futuro. Sé que, por ejemplo, Kaiser está considerando tener un generador en casos de que esto vuelve a ocurrir, pero a veces perdimos de poder y es la realidad de la vida.
Hi, Governor Jared Polis, Claire Cleveland, CPR News. You said you were told 3 days ago, I think, that the state would get the more than 250,000 doses from the reserve. But on Wednesday, General Scott Sherman told CPR News we were expecting the same amount as usual that you put on the whiteboard. I'm just wondering when exactly you were told the 250,000 reserve dose number. Can you clarify the timeline for me?
Yeah, so the weekly flow is different than the one-time infusion that would have been given from the distribution of the non-existent National Reserve. They're two different things. So we have a very small bump in our weekly supply, perhaps even a different number than General Sherman provided. It's 77,950. And I don't know whether the number he gave you could have been as low as 69,000 or could have been 74,000 or could have been this full number. But this is what the weekly flow is. That was, at no point was that expected to change. And as I said, there is actually a modest bump in that. That number was about 74,000 by our count. Remember, we up it. It was 69,000 by federal count, 74,000 by our count. It's now 77,950 by our count. The other piece was one time. We had been not only informed, but of course it had been reported on by the press as well, that there were mirrored doses held in reserve that would be sent out for the second dose of the vaccine 21 days later or 28 days later, depending on the vaccine. We were informed, and there was a lot of pomp and circumstance, Secretary Azar, others, we're going to send out all those doses that we've been holding back. Our calculation was that was between 200 and 250,000 for Colorado. That was about a 3-week one-time supply. So that was not a change to our weekly supply. That was a one-time deployment of what turned out to be a non-existent National Reserve.
Hi, Governor. This is Megan from KKTV 11 News in Colorado Springs. I was just wondering if you could touch on how you found out that you weren't going to get those, or the state wasn't going to get those additional promised vaccines, and does this change the vaccine plan process at all?
I found out on the phone with General Perna this morning, and I don't attribute this communications problem to him whatsoever, to be clear. I attributed it, though, to those who spoke out of turn, including Secretary Azar, the Vice President, and the President, that indicated that this was coming. So he clarified that for me, gave us the facts, and the latest numbers I have on the numbers likely going up to 90 to 100,000. Those are reasonable projections based on my readout of that conversation with the general in charge of logistics and distribution. What was your second question?
Just if this will change the plan with vaccine distribution or anything like that.
No, we will still reach our 70% of 70 up by the end of February, but a lot of the upside that we thought we would recognize because of all the discussion, which we supported, of distributing the reserve of the ones that were held back for the second dose, has come to nothing because it turns out there was no second dose reserve. So there was a lot of upside. We were hopeful that there'd be a more aggressive timeline sooner for getting to others, but I'm still confident we'll meet our initial timeline because we did base that on the conservative figures of what we knew we could expect through the normal supply chain, because we didn't know for sure at that point that the reserve of doses for second doses would be released. Never in our wildest dreams did we think it didn't exist, but we didn't know for sure it would be released. Thank you all for joining us. Stay safe. Avoid socializing with people outside of your home. Wear a mask. Let's get through this. People are being protected every day. For you and your friends and your aunts and your uncles, or if you're 70 and up, if you see a provider that's a major hospital, you're probably already on their list, but visit our covid19.colorado.gov site, sign up at a provider near you. You may be fortunate and have the opportunity to set up an appointment in 2 days. You may have an appointment in 2 weeks or 3 weeks, but everybody who's over 70 who wants it, I remain extremely confident by the end of February, you'll have the opportunity to begin your protection clock and get your life back. Thank you.